Hi, this is Dr. Lori Baudino. I'm doing a collaborative check-in today with Dr. Shelley Stravitz, and I am so excited to have you. We've already been talking off camera, and it's just so many stories we could share and such a like-minded approach to supporting children and families, and what joy we both have, right? It's just beaming out of us. So I thought we got to share this with families so they know how wonderful therapy can be and that there is support out there. So Dr. Shelley, will you tell us about your work and where you are?
Well, I can tell you about my work. I'm in Los Angeles, but I've been virtual for about 20 years.
Mhm.
And in fact, I've had other therapists call me during the pandemic to say, "How do you do Zoom?" which was very funny. And the reason I went virtual is because it really gives us the opportunity to speak to both parents at the same time when the child is otherwise engaged. And we base our conversation on video, which is so easy for us to do these days with everybody's cell phones. When we began, everybody had these huge video.
Yeah.
I work in relationship-based and developmental therapies. A way to understand that would be to look into the DIR floor time model, and as well, I'm trained in the Sunrise program. So I bring the two together, and I look very closely not only at the child but at the family system. And this is a very loving, accepting, non-judgmental process, which begins with the child, right? And begins with, what does the child love to do? Even if it's flapping, we're fine. Where are they developmentally? So we meet them where they are, right? And then through relational play with really their first teachers, the parents. And of course, helping the parents to know that they cannot possibly break their child, that they can have fun and they can be silly and they can enjoy, because this is the way children who are not neurodiverse develop and learn. It looks like a miracle, but in fact, what it is giving the child the opportunity, right, at their own pace,
Absolutely.
go through steps of development. And my role is to educate and empower the parent so that beyond the 1 hour that we speak each week, they can be doing this throughout the day, 7 days a week. So we see incredible progress in the children.
Mhm.
They also work with the parents. They may have other therapists that it's been determined that they work with. So I'm usually very close to a psychologist or the OT or the speech. And
Mhm.
sometimes it's developmental vision, and sometimes it's nutritional needs, right? So my approach is really 360 degrees. And
With you.
as I was saying earlier, I think it was 2015, I published, after 21 years of my practice, a very extensive research, health evaluation research. I wanted to make sure that I was doing everything that was going to meet the needs of families and their children. So aside from the parents themselves, we also had every professional that was around that child, and if there were aunts and uncles who were involved, if there were volunteers, which there were very often, if they were autism interventionists. So we had a wonderful 360 view of that child over time. In the very early days, I'll be honest, the children that I saw were parents who came to me and said, "My child is failing
Yeah.
their intervention." I'm like, how does a child fail? The intervention could fail, but not the child. I was seeing some, significant cases of autism, and all the children were nonverbal and so on. Well, actually, in research, in the literature, it tells us that 10% of children can have optimal outcomes. And at that time, 70% of the children had optimal outcomes, and another 20% had a secondary optimal outcome. But I do want to mention this. In the situations where that didn't happen, we were able to look at it and realize that what they had in common was that they all stopped their intervention too soon.
Mm.
So it was the others who stayed the marathon.
Right. Right.
So I started with 2-year-olds or 3-year-olds. I was still there when they were thinking about, do I want to go to college and what's best for me? Right. So we really went from infancy all the way through adolescence together and so on. And I've got one that I'm going to graduation for right nearby here in June, which I'm excited about.
Yeah, it's such a true testament of that relationship, right? And that relationship doesn't just end.
No, it doesn't end.
But what I'm also hearing, what I'm also hearing is the connection that you're giving to the parents, that it is that system, so that ultimately the relationship is what's supporting the child, is building that, foundation. I do analogy of a castle, is building that foundation.
Yeah.
And then it's not that you disappear on them. I often say this about my work. I don't disappear on the children. However, I do want to give every support to a parent and the community that they're in, so that it's not that I'm the cure-all,
Mhm.
right? Or the technique, you said it's either the technique, it doesn't work or it works. It's not that. It's actually like the relationship is what that builds up the
It's the
child.
relationship with the parent, which we still have, even though their kids are out of college and out in the world. It's the relationship that they have with their child. And by the way, the grandparents and the
Yep. Extended
siblings, right?
siblings. Yep.
So
Right.
differently than we see in general in the autism field or ADHD field, the research showed that if parents came to us married, they were still happily married when they were interviewed for 2015 research. We asked about the siblings because some of them didn't find out their child had autism until the second one was 6 months old, right?
Right.
And the siblings were astounded. They were just incredible young people. So I asked in an interview of the parents why they thought that was. And they said, well, it was the way that we learned to parent our child with autism that made us terrific parents for this sibling,
Yeah.
right? So it
Yeah.
really, when you look at what are the stresses that come in around a family, and as I told you, I know very well what they are, because 32 years ago, our child was born severely premature. And by one, although he'd been right there with me, he disappeared and he was diagnosed with severe autism. At the time, the term was this, severe mental retardation. I was told he would never speak and that he would never recognize me again.
Hmm.
Well,
You didn't allow that. You didn't allow that.
I don't listen that closely.
Yeah.
The interesting thing is, let's just take the intellectual disability part, okay, which I clearly didn't listen to. I followed the child, right? And as I told you, I can speak about him till the age of 8. Then we have an agreement that he's entitled to his life. The one thing I will tell you, for this child who was supposed to be severely mentally retarded, he graduated in the top 1% of his university. No accommodations, no nothing. So by the age of 8, Dr. Stanley Greenspan had completely declassified him. And I think that somehow the universe wanted me to have that experience. I was training as a health psychologist at the time, and I shifted over because I could see that when you support, even in the NICU, when you support the child, when you support the nurses, when you support the parent at the next crib, right? Those children thrived. And when the parents were hysterical, they were removed and those babies didn't. So that was, especially the health psychologist in me, that was very real, right? Yeah. And so I carried it out. Once my child was doing well, all of the therapists were now asking me to work with the parents they were working with. And that's really how it started. And then I went on to get my doctorate. So
yeah, thank you so much for sharing your story and your experience. It really resonates with me so much. I feel like I've always come across that adversity and hearing these words and saying, how is that serving us? I've worked in hospitals, and even to this day, hearing people say, like, you're going to be in a lot of pain to a patient, or, they're at the end of their life. I've worked with terminal ill children, cancers, and thinking, well, we don't want to give them false promises, is a fear that can be said. And I know this might be controversial even as I'm saying this, but just that it's just how much that mindset can shift, and the relationships can shift our health. And it's so scary to talk about, but it doesn't have to be. Yeah.
Well, and I've heard people say you can't give people false hope. I began this process of doing a degree in health psychology, and I was working with terminal cancer patients. I think a false hope is an oxymoron. How can hope ever be false?
Exactly.
And I only left that because suddenly my child was premature. But those people that I worked with some 32 years ago, I met them. They all were described as terminal. Not a single one of them had passed in all the months that we worked together. And it was because we really went towards, it's kind of thinking back to Norman Cousins' Anatomy of an Illness. He just didn't accept what they were telling him. And I believe you don't even need to hear that. What you need to know is, I've had parents say to me, with a child diagnosed with a, full autism, oh, but I wanted to go to college and I wanted to speak to thousands of people. And here's this little 2-year-old who has no language. And I would say, tell you what, let's not futurize. Let's not worry about 20 years from now. Yeah. Let's focus on today, because today will take care of tomorrow, and tomorrow will take care of the next day. And sure enough, it's exactly what happened.
Right.
I could wound up on Wall Street.
Right. Another way we can say this is actually being accurate. We don't have to say, we don't have to be fortune tellers of the future, but being accurate with what we have in front of us. So we can feel in this moment this ease and this connection, and therefore
yes. And I think there's one thing we can take from the past, because the past is where stress is and upset is and anger and fear is. But the one thing we can take from the past is we can say to a parent, I can say, I've been working with families for 30 years. Yeah. I have seen incredible things. I have seen families take the impossible and make it possible. Yeah. Autism does not have to be a life sentence, right? So and where do you think this joy comes from? It comes from doing the work and knowing. And in each case, each family did it their way, within their means and their system, their family system. Right. And it was a beautiful thing.
Yeah, yeah. I know before we were talking about off camera, we were talking about behaviors and ensuring that children are understood. I didn't mention to you, but my kind of phrase is it's not personal, it's physical. Mm-hmm. So meaning that a child is seen as it's personal, they're being aggressive, and instead of seeing them as aggressive, they're just moving physically, correct, quick and strong. And so it's a quality, it's a choice. And sometimes they need support on how and where to use that choice, or what got them to use that choice.
Sometimes it is the body, because we work with them from the bottom up, yes. Right? Yeah. And sometimes it is the body in those moments. And we have all experienced, either for ourselves or an adult next to us at work, someone who gets so angry that they're out of control, right? They can't find the words. They're just screaming. They might be knocking things down, right? That's a perfectly reasonable adult who can't contain in his body, right? And that's what's happening with our children, right? And so the silliest thing is to expect them to sit still. Yeah. But the thing that we can understand is that through their behavior, because they're in that moment, they may not have the words, or in that moment, they can't access what's up here. Yeah. Because the body's overwhelmed with that word feelings, and the feelings are felt in the body. So it could either be the autonomic nervous system, which is fight, flight, or freeze, or it could be the sensory systems or sensory processing, or frankly, a loud noise that just frightens them in the whole. So the wonderful way to get there, right, to really be able to help that child express it is through movement. Right. Get it out of the body.
Yeah. Well, you're speaking my language.
Yes. So, what we talk about is the parent's key role, really. And I'm actually doing something for Epidemic Answers. I hope that's okay that I mentioned it's a nonprofit.
Yes, I wanted you to tell us about it. Yeah, what is Epidemic Answers?
Is just a fantastic site and resource for professionals and parents. We just offer this information for free. It's an incredible library of webinars and blogs and being taught by people who've been doing this a long time. Anyway, so I'm doing one right now exactly on this topic. I work in developmental and relationship-based therapies. By the way, OT, SIOT, sensory integration, it's a developmental therapy, right? Yes. Speech. Yes. You have to be able to make sounds before you start to make words, and words, it's all developmental, right? Yes. What we know is that when children are given the opportunity with their parents just to play, right? Let's say a parent says to me, he doesn't even know I'm in the room, right? Then the first thing we need to do, the key role of a parent, is what we call co-regulate the child. If the child doesn't have the ability to calm it come to a calm, organized place to play, then what we do is we teach parents, because once you can help your child through your own calm, for him to be or she to be calm and organized, then she'll be available.
Right.
So first thing you got to do is parent has to take a couple of deep breaths and be self-regulated, realizing that the behavior that we might be seeing, again, if you just think about, you can think about it as emotional or physical lack of regulation, right? So first you get yourself there, right? I'm going to be in that class that I'm doing. And then once you get yourself to that place and you realize they're not bad kids. There are so few bad kids in the entire world, but they're kids who need help to get themselves to a place. So even if I was that office worker who was so angry, right? Calm them down, get them to be able to, okay, now tell me what happened.
Yes, right. Now we can talk, right?
Right. So that's basically what we're doing. And we're doing it by offering some movement, some heavy work, some music. There's lots of wonderful ways, and each child responds differently to different things. So it's great to, if you have an SIOT, to ask them. What we refer to is to ask the SIOT to help you develop what's called a sensory diet.
Yeah.
And maybe a sensory diet has some food in it that your child prefers, but it mostly is different kinds of movement and breathing.
Yeah.
And your OT can really help you to figure out what your child will benefit from.
Absolutely.
We can use that. And once that child is calm and organized, then the play begins. And the play comes just from whatever the child enjoys, because what we know, thank you, Dr. Stanley Greenspan, is that children develop in warm, loving relationships, in joyous relational interactions. So yeah, they're going to have moments where they're not happy, and they'll experience those moments, but they'll also have a chance to problem solve with you and come to a place where they're much more comfortable. So it doesn't matter what you play, but the child determines the play. So here's an example. You bring a brand new Candyland into the room with you. You know, wow, I just bought it. It's great, right? I'm going to teach him this game. I loved it when I was a kid. And you bring in the box of Candyland and you take out the parts. And what does your child love? The box. And so we find lots of fun ways to play with the box. Absolutely. Because that's where the child's motivation is. And in doing that, your child is slowly going to higher levels of development. You'll get to the game.
Yeah. That's the key, right? You'll get to the game. Yeah, there is that balance of honoring where the child is, honoring who they are, and then also giving them the support where and when it's needed so that they can thrive, because we're not kind of saying you have to stay stuck in this place. There is an evolution, and I think it's so important to keep gradually, moving along with them. I see it as a dance, we're taking turns leading and following. And
well, we have found over the last 30 years that, although autism is diagnosed by outward observable behavior, in reality, it's the underlying issues that each individual child has that is preventing development and is causing those behaviors, most of which are ways that the child has learned by himself to deal with anxiety and stress.
Protect themselves, yeah.
Right, to protect themselves. So when we take those movements away without dealing with the underlying issues, can you imagine someone telling you you can't start your day with coffee, right? Or no, I'm sorry, you might like that nice crunchy food, but you're going to have to eat this farina, right? You're going to have something that you don't necessarily like. Children find what really feeds their systems, just as we do. And then it can be movement, all kinds of things in the sensory diet. Yeah. And I can tell you, with my son, he took on the world. I had a little sensory diet emergency bag with me. Yeah. So that if something started to look like he was going to kind of lose his organization, his calm, I could, in his case, I could give him a piece of gum, a big piece of gum.
Get that
like a baseball player.
Right.
Nobody questions why the baseball player is chewing.
Why they're organizing and
That's
regulating.
right. They're organizing so that they can do the exact pitch they want to get. So our kids are pretty smart. And if we don't take it away, I will say on one day I counted with my own child, and we've been at it a while, 15 different outwardly observable repetitive behaviors.
Mhm, mhm.
In the end, he had one. We didn't take any of them away.
Right.
And at that moment, he used to circle. And at that moment, my husband, who had a, pretty responsible job, said, it's interesting. I circle the conference table. When everybody's there, I get up and I circle.
Yeah.
Helped him to organize. And 3 months later, I said to him, when was the last time you saw him circle? It just, when the child's getting what he needs, those disappear. They
Right.
resolve.
And it's about helping them know how to have the ability to withhold, to moderate, to organize. We call it regulation. So we're not taking things away and saying stop doing that, but we're saying here you can, and then the child is able to say or get to a place in their body where they know how to have that.
That's right. We find that even among our typical children, really, it's not till 6, 7, 8 when kids really have an idea of, I'm starting to feel a little overwhelmed. I'm going to go on the backyard swing set, where they
Right.
do that for themselves. So parents are always supporting in some way. And our children who are having difficulty taking the world in just need more support. By the way, do they need it the rest of their lives? No. No, because once they get what they need and they develop, right, just like everybody else, they may do something that they enjoy. They might like swimming or running or any kind of leisure activity,
Right.
but no, they will not constantly need what we offer in the sensory diet down the road. I can tell you that one too, because all the kids that I started with are 20s and 30s. So
Yeah, I can attest to it too. Dr. Shelley, I'm aware that we could talk for hours. I hope I hope those listening are part of this dialogue, are kind of asking themselves, am I taking this relationship approach? Am I seeking out support? Am I aware that there are options? And so how can people reach out to you?
My website is drshellystravitz.com. You can reach me at support@drshellystravitz.com. As well, I do a free introductory session with every parent who calls. If they decide they want support so that they can feel empowered, because when we empower that parent, we literally start to see that child change. It's amazing. We lift the stress. And so some parents choose to then want to have weekly sessions, and I work with both mom and dad if they want. Usually that's what they do. And other than that, I do something that I refer to as the roadmap. Some people just want to know, what should we be doing now and what should we be doing before and in the future for her. And so in 2 sessions, I do a roadmap, and that would be extra from the introductory, so that they have a real clear picture of looking at that child. What's that child going to need? And you can pretty much see where you're going to be going from the beginning, So I'm happy to do that for parents who feel they don't necessarily want to, the kind of ongoing support that I can provide for them. And it's all virtual. They can be anywhere.
Right. Thank you so much for talking today. I have had so much joy in just that camaraderie, that we are in this together and that we can support so many incredible families.
My life is all about helping as many families as I possibly can. Thank you so much for today. I really appreciate it. Take care.